Okay, so we've got this case study to do. So this lady saying hello, right there, that's supposed to be me, the nurse. I'm going to tell you about my patient from a few weeks ago. We'll call him Mr. Friend. That's him. He's saying hello too. He doesn't speak English very well. He's from somewhere around there. So he comes into the ED one day with his daughter, not feeling too good. He talks to a doctor there who's like, okay, let me take a look at you. Tell me what's wrong. And Mr. Friend's like, Doc, I've had a week of nausea, vomiting, increased bowel movements, pain, and wait, where am I? And the doc's like, okay, cool, let's move you on up to the floor. And look, there I am again, the nurse. Officially. So wait, get it? Wait? Yeah, lame. Anyways, at this point, I should tell you more about Mr. Friend and what his physical Facebook page would look like. So he's 66 years young with end-stage liver disease secondary to non-alcoholic steatohepatitis, not from drinking, and he's currently on the transplant list. His baseline creatinine is 4. Yep, 4. And he's got hepatic encephalopathy, in addition to diabetic nephropathy, thrombocytopenia, type 2 diabetes, hypertension, and Parkinson's disease. He's married and lives at home with his wife. We'll call her Mrs. Friend. He's a pretty independent guy, but his daughter's like, he's getting much more lethargic. He's slurring his words. He's much more yellow. Not to mention, he keeps throwing up and is super nauseous all the time. So we get him up to good old 3 East and start treating him with lactulose. Poor guy's having like 8 bowel movements a day, and yet he's still pleasant and sweet. His abdomen is diffusely tender to palpation, and his chest x-ray and urine analysis came back negative. His bedside abdominal ultrasound shows no fluid to be tapped. His labs come back and are pretty much what we expected. His BUN's 91, his creatinine's 5.08, and it keeps trending up. His ammonia level is 119, but apparently his baseline is mid-90s to 150, so it's pretty much the norm for Mr. Friend here. So we're all like, alright, easy peasy. Let's treat him with some lactulose, try to get him to have 3 bowel movements a day, and continue trending his ammonia levels. Then Buddy can go home. So all is fine and dandy. He's doing better. He's much more alert by day 2. He knows who he is, and sometimes knows where he is, and can follow simple commands pretty well. He has some pain, but doesn't want any pain medications for it. His ammonia is up to 120, but that's still pretty normal for Mr. Friend. His creatinine keeps going up. It's now 5.36. We receive an order that his left arm is not to be used for blood draws or venipunctures. They're saving it for a possible AV fistula. So, still day 2, plan hasn't changed much. We're continuing with the lactulose and watching his ammonia levels. We stuck a tab alarm under Mr. Friend because he keeps getting up to use the bathroom, but he's pretty darn unsteady, and we all know falls are a no-no in the hospital. Day 3 is much of the same. Mr. Friend is now alert and oriented times 3. He's doing much better, feeling much better. There's a physical therapy consult in pending his discharge, as well as a renal consult. And then Mr. Friend can go home. Yay! Let's fast forward to day 4. We have a new patient. No, Mr. Friend hasn't been discharged, but I walked in to see him and was like, who the heck is this? Mr. Friend is super confused, super out of it, super not himself. He has no idea where he is or what he's doing. He's been vomiting every time he tries to eat, and he's asking for pain medication, which he doesn't like to take. Nutrition was consulted, and they put him on Glucerna to help correct his imbalanced nutritional status. I talked to the doc, and he's like, yeah, we might send him home later today. Obvi, I'm a bit concerned. They've done nothing with the fistula, and the only treatment he received was the lactulose, which he's still on, but this downward swing is a bit concerning. But when I asked him, the doc says, nope, we aren't doing a fistula. We don't think his current condition is related to uremic acid buildup. It's probably just his ammonia levels, since they're now up to 240. I'm still kind of like, hold the fort. He's on lactulose, he's been stooling, his levels are still going up, and he's way out of it. Something's going on here. Why aren't we checking with renal?
created using Powtoon.